Welcome to the Reverse Mullet Healthcare Podcast from BP2 Health. Today we are at Health, and I'm with my co-host Ellen Brown.
And I'm with my co-host, Justin Mullet. We're going to introduce each other today. And we have a guest co-host,
Aaron Martin with Fresh RX.
Because, you know, we might like food a little bit and think food is part of health. But
yeah, we're inserting it here, aren't we?
Super excited for our guest today, Andrew Toy.
Yes.
And we happen to be big fans of what Andrew's doing. And we were lucky enough to grab 15 minutes for a Live at Health edition. So, Andrew, tell us about yourself.
Sure. Yeah. My name's Andrew Toy. I'm the CEO of Clover Health. We're a Medicare Advantage plan, mainly based out of New Jersey. We only serve Medicare Advantage. So that's the seniors and disabled folks. And we're very, very focused on the early detection and management of chronic disease, a major passion of mine.
Okay. So I don't even think that Justin was with me. So we had lunch with, I won't lose any names here, but we had lunch with, you actually really like what I have to say. So we were having lunch with a virtual primary care organization and one of their founders. I still don't think I'm going to give them away. And we were talking about platforms and we were talking about Medicare Advantage plans. And he brought up that their physicians that they employ love running into the Clover platform because of the information that it brings them.
Oh, that's fantastic.
And I was like, oh my gosh, this is so great because we think it's such an interesting spin on just Medicare Advantage in general. So to hear it from the clinical side,
the virtual guys,
the virtual guys,
yeah, they love it.
He was like, it's such a great tool. I thought you would love to hear that.
I love that.
And I didn't intentionally plan that.
I did not plan that either.
Yeah, exactly.
This is the first time I'm hearing about it, and I'm absolutely delighted. That's what we're going for. I think the idea is to actually, I wish it wasn't so unusual, but to be a managed care company who wants to help clinicians manage care.
Wow. What an idea.
Yeah, that seems like, I was like, isn't that the job? I thought that's what we were going to do. Yeah, so I'm delighted. Thanks for sharing that.
Yeah,
that's awesome.
I thought you would enjoy that. So talk for a minute about your AI assistant and just what you've built.
Tell us more.
Yeah, absolutely. So our whole goal is to serve seniors by empowering their physicians. And so the idea is, instead of having, like in managed care, it's in vogue right now, you have a lot of care management teams and things like that inside the plan. You guys all know about that.
Oh, yeah.
We don't employ like any of those really kind of people. We do have some of our own physicians, but what we do is we build software so that the physicians who are already out there, the primary care physicians, can get access to more data and practice medicine the way they want. And by doing that, they'll do a better job, really. It's as simple as that.
And then you deploy AI as well.
Yeah, so that's behind the scenes. So we don't brand it across there. But I think that my thesis, speaking as a technologist, is AI just makes technology more human. That's its entire job, right? And so behind the scenes, what the AI is doing is sort of anticipating what would be interesting and important for a primary care physician to see.
So this person actually said that that's what their clinicians experience.
Oh, I'm even more pleased.
Described it just like that.
That's what we're going for. Once, I was talking to a payer and they were like, oh yeah, but how are you going to make physicians do what you want? And I was like, I think the phrasing of your question is just inherently the wrong thing to say.
Offensive.
I mean, I think if you're going to try and make them do it, they're going to not want to do it. I mean, I already don't want to do what you want, and I just heard. So what the AI is doing is positioning. I always say it should feel to a physician like they were doing something that felt really natural, that they were already going to do, even though in our data we clearly see that they might not have done it. That's where the AI really comes in to smooth over that data, to frame it in a way that is really effective.
I know with my 15-year-old that the power of suggestion is a lot better than authority. So I think you just made me think of that analogy. I was like, this applies to me as a parent. So
natural behavior.
Yes, exactly.
It sounds so intuitive, but things are done so differently within managed care plans than that. how did you think of this? Like, how did you come up with this?
So I think about that a lot. I actually don't know the root. It was fairly intuitive to me, and that's not trying to me saying that I'm smarter than everyone else. But I think what probably informs this is I was giving a version of this talk once. I talked about the assistant, and I talked about our approach. And then someone came up at the end. They're like, okay, they talked to me, and they're like, because you're a doctor, right? I was like, no, I'm not a doctor. I'm a computer scientist. And he's like, oh no, you must be a doctor. Like no one would talk like this. And then I mentioned, and you probably might have seen, like, but I'm public that I have a condition called Marfan syndrome. It's a congenital condition. It's a connective tissue disorder. It's genetic, so I've had it since I was born. I've been very well managed, but I'm a very high touch. I touch the healthcare system every year. I go in for like scans and things like that. And then when I explained that, I think that this particular person was like, no, that's what it is.
Okay.
You're not a doctor, but because you're so engaged with the healthcare system.
Yeah, you see what the problems are.
That's right. Like he was literally, like, this is not intuitive to most people because most people just don't.
They aren't accessing the way that you are.
By the time they do, they're on Medicare and I'm looking after them. Basically on the other side of things. But
well, and the other thing that I figured out is true in our conversations preparing for this is you are in fact an engineer.
I am an engineer.
I have now, yes. And as we have really jumped into this quest of finding the unicorns in healthcare of people that are really truly doing things differently. What I am blown away with is I think it's probably what, Justin, like 9 out of 10 people are engineers by training that fall into the, I'm not joking. Like it would be an interesting study that when you really look at who is not just like doing what you're supposed to do, how you've always done it, but maybe slightly better.
Sure.
Yeah.
It's like, it's the people that are design and systems thinkers that
you're trained to solve problems.
We started to purposefully stop asking people about people's background until we hear a little bit more. And then we're like, oh, this is really interesting. And then it's like, what do you do?
Engineer.
I was an engineer.
It's like, it's amazing. So, all right, I'm going to ask you the big question that we ask everybody. So what do you think can affect real, all caps, change in healthcare?
Sort of so many things, so many points.
Yeah, and you have like
pressure.
4 minutes, right?
Yeah. No, so I'll keep the really.
Only one word, actually.
Okay, I can do it in one word.
Oh, wow.
Impressive.
So my word is education, but it's probably not the kind of education you might think it's going to be.
Okay.
Because it's not clinical education. I can take care of that. I think AI will help a lot with that. The kind of education is when I think about this is before I came into Clover, I was the kind of person who I did not even know what an EOB is. And I deliberately say EOB for the listeners who are like, what is an EOB? I'm like, you can check. I can guarantee you have one.
Yeah, you might know what that is.
What is an EOB? And you're all laughing because you know exactly what I mean by that. But I was the kind of person where I was like, okay, EOB. And at the top it says, this is not a bill. And I'm like, then why did you send it to me? I don't understand what this is for. Like, what do you want me to do with this? And then I would just give it to my wife. I'm like, here you go.
That sounds familiar.
You just get this and you can do what you like with it, right? I didn't understand co-pays. I certainly didn't understand co-insurance, right? I did like pre-auth, like all those things.
All those horrible words.
All those things. And so if you think about it, like what do we normally do when someone doesn't understand really important things? We teach them those important things, right? Like that's education. But where do you go to learn these things? Like how many of your friends, I'm sure you guys have these conversations where like, they're like, oh, I don't understand it. I'm like, okay, I got to take you through this. This is how this is going to work.
And then their eyes glaze over very quickly.
That's right. Their eyes glaze over.
It's all green.
That's right. But then you're like, but this is so important. It's so important.
Yeah,
this is
you
not
need
a joke.
to be looking at those. Yeah.
You need to be looking at those. Or if they call and they're like, oh, my insurance won't pay for it. And I'm like, no. That's right. The conversation
take no for an answer.
does not end there, right? Like, exactly. Like where do you even learn that, right? Like who's teaching you those things? So to me, learning to navigate the healthcare system, now knowing what I know, right? I'm like, okay, ChatGPT is going to write a protest letter, if you deny me something, like we'll take care of this. And so I think that's a really important thing that we could do.
That's really interesting. Okay, so you guys have any more questions? We have 3 additional minutes. Aaron, your eyes just got big. You have a question?
Yeah, I had one and then it just escaped me. Come on, it'll come back. Okay, so yes. So Casey and Kelly Means are on Joe Rogan's podcast and they were talking about that doctors should be writing a medical necessity letter for people to have for food. For food.
Yeah.
And I think, and so that way for exercise, and that way their HSAs could pay for that. And I was just interested to see, what do you think about that? Is that something that you've seen happen, or do you think that's something they could be asking their primary care doctors for?
This is why we have the guest co-host, because she comes up with questions that Justin and I would never ask.
So a couple different dimensions there. Like, I don't necessarily think this is a procedural answer. I don't, as an insurance person, I'm not 100% sure that just because your doctor would write an order for it, that I would necessarily cover it out of an HSA. But I would have to read the statute and the rules around that. I think spiritually, it makes sense. I think the issue that I see when you actually go in there, and we have done a lot of stuff, like if we looked at like food as medicine and all these kinds of things, is that the dimension of this, and this is an innate part of healthcare, is that what people actually, and I'm sure you run into this all the time, what people want to do is not remotely correlated to what is good for them.
Oh,
right?
sure.
And so where my mind first goes to is the kind of person who already wants to use their HSA dollars to buy food that is good for them.
It's a different person.
It's different.
Right.
Now, could you find someone who wants to use their HSA to buy Doritos?
Oh, I'm
all
sure.
day long. Can you find someone who wants to use their HSA to buy Doritos? But you see what I'm saying there, right? It's just like, but if you're like, you have
to be a pretty educated consumer to be asking your doctor for that.
That's right.
Absolutely.
That's right. And then there's now a massive selection bias around those people who would have that conversation in the first place. And so I'm all for it. I think it's a good idea, but I'm not sure where it cracks the nut on
I
that
just
problem.
got an idea that I will leave. I will leave my idea, and like it'll be like a mic drop walk. Is how do you incorporate food education for providers into an AI tool? So like ICD-9 codes are informing it, medical history is informing it, right? But then it's like, can you then? It's not just food. It gets to. Does that AI get to a point where it actually helps educate providers on the knowledge gap?
Yes.
Sorry.
So I have a very specific view here, but this is a podcast. So I'm going to give this is not my official work view, but I'm going to give a podcast view. So I have a personal view that one of the reasons why physicians have a difficult time on food as education is at the end of the day, we physicians are people too. And I think that there's a certain layer of it where like I don't think most physicians necessarily follow all the same rules. In fact, I'm pretty sure that they don't. I'm being very generous in that statement. And so it's difficult for them to do it because it's hard to talk to somebody about, give them advice.
Yeah, when you're a human,
when you don't follow it yourself.
Or even know it.
Or know it. So my answer
and they're not trained in it.
So my answer is basically here is that the physician, we can actually just have the AI have the conversation on behalf of the physician, and even if we train them, take them out of that awkward position.
Sure.
It's like that.
And then they can be like, look, I think you should have a chat with this nutrition.
Yes.
And then they'll have the nice chat. I'll do all those things, and the physician doesn't have to do that anymore.
I love it. This is such a great. I always like talking to you.
Thank you.
I was looking forward to having you.
Just a very unique point of view, and like it is.
It's refreshing.
That's the word.
It's refreshing.
Okay.
Well, we wish all the success to Clover Health. We really do. We're excited to see what all you do.
And we're excited to see the success that you're realizing. It's well earned.
Yeah, thanks for sharing that story. I really, that's really nice.
It was very good timing.
People like it.
Yeah. Well, thanks, Andrew.
Thank you.
Thanks so much, Andrew.
Thank you. Thank you.